Hi everyone. Do you know that one of the most common reason for chaotic relationship and stressful work environment is this type of borderline personality disorder? Uh, in other words, one of the most important reason we have this kind of the crazy and unstable relationship and or stressful in our work environment is that we are dealing with the person with borderline disorder. Before I go to that topic, explain that, I would like to explain a little about how the brain work. As we know, the function of the brain, we called it mind. And how the brain work depending of the structure and function. Sometimes we have structural problem, sometimes we have functional problem depending of the which part of the those system has been disturbed. We have four condition or four situations for the state of the mind. One of them is normal. Second one is personality disorder. Another one is neurosis, and finally psychosis. The main differences between psychosis and the other three condition and situation is that the connection of the person with reality has been disturbed. So they lost and they disconnected with reality. At top of them, everybody knows schizophrenia or schizophrenia is one of the most common famous psychotic disease. The other three conditions still person has connect and contact with the reality. For understanding the differences between these four situation and condition, let me bring in a scenario. Imagine on the very not too much crowded alley, we are walking and some person come toward us, look at us, smile, friendly smile, and shake hand. A normal person, the reaction of and thought of the person is will be almost is the same, smiling and shaking head, and maybe maximum say hello and what a beautiful day, and the only maybe think what a beautiful lady or what a handsome and nice guys. That's it. That is the mind of a normal person work. In personality disorder, the people they have some type of the personality disorder. Depending on what type of the personality disorder we have, the reaction and mind and thought of the person will be different. For example, it can the person think, oh, he or she is attracted to me, interested in me. Should I go and make some communication and conversation? Or is that person know me? Maybe I know him or I know her some way, thinking and bringing and go searching and digging about that situation and find what is happening. That is the person with the personality disorder mind working. In neurosis, person the mind and thought thinking in the level of the stress and anxiety. How, for example, this person with neurosis maybe ask herself or himself why he or she look at me and smile, how he dare look at me and smile, or did I did something wrong, or do I have dressed some way bad way, or there is something funny. That is the or if the person come ask me some question, what should I do? That is the neurotic person react in that situation. A psychotic person in this situation maybe think, depending of type of the psychosis the person has, maybe think, oh, he came from the God and want to give me some message, or he is not human, he is some angel or animal, he want to do something to me, or he brought some he told me, even the person didn't talk, he told me something. That is the differences between these four conditions in the mind, that how the brain and mind work. Now let's go see a little static of this borderline personality disorder, then we start our topic. First of all, 10% of the people in the society age above teenager above, they have some kind of personality disorder. We have almost 10 types of the personality disorder. So 10% of the people, they have one type of those 10 type of the personality disorder. Second, 2 to 5% of the population, adult population, teenager above, they have borderline personality disorder. So it's not uncommon. Actually, it's common. If you put it in the society, you can see from each 10 relationship or society environment working, we are dealing with 2 to at least from 100, at least 2 or 5 of them, they are borderline. But this prevalence increased to 20% in those people has been hospitalized in psychology department. About 75% of the people with this type of borderline personality disorder, they are women, and there is many reasons for that. One of the most important is that their childhood experience and trauma in the kids, especially in girl, is more common than men. But that is one reason. There are many reasons that I am not going to that deeply. And unfortunately, 80% of the people with borderline personality disorder, they have history of the suicide attempt. And unfortunately, 10% of them die. That most of those successful suicide attempts are male. That is the little difference between male and female, because one of the reasons is that male are more goal-oriented and determined, female more politic and sophisticated and complex, and so that is the one of the reason why successful suicide attempts in men are more than women. We have 10 types of personality disorder. That one of the most common type is borderline personality disorder. And the reason it called borderline, because this group of the people in some situation, their mind move to the psychosis and neurosis and almost close to the normal. So their mind and thoughts swinging between those situations very easy. That is the reason we called it borderline. So that is the reason 20% of the people that hospitalized in psychic hospital and department are this group of the people. So that is the definition of the borderline disorder that we use it. As I mentioned, 2 to 5% of the population above adolescence age, they have this type of the personality disorder, and this disorder is responsible for most, and not most, but this play a major role in those chaotic relationship and toxic, stressful work environment, because we are dealing with this type of the people. And before I forget, I want to mention right away here that if you think that I am going to explain those criteria, if you think you have this type of personality disorder, first of all, go check with the psychiatrist or psychologist, make sure you have it or not. Second, don't involve to any serious relationship because it doesn't help you. It hurt at the end yourself and the other person. After you getting help, there is a chance, very high chance with the correct treatment that most of the time is cognitive behavior therapy. Most of the time it takes few years or more, sometimes 5-10 years, a little, sometimes depending of the cause and severity of disorder. It takes time, but it can be controllable and you can go back to normal life. And if you are the person that involving with such person and you want to start relationship, stop there. Don't start any serious relationship with this person, with this type of personality, because you cannot help them. You can support them, but you cannot change them. You cannot fix them. They need professional help, and usually it doesn't end with a good result. So let them and help them, support them to fix them if they are on the way to the healing and controlling. Then they make decision if you are going to relationship or not. Okay. Now, this borderline personality disorder characterized by 9 traits or characters. If we have 5 of them, most probably we have this type of the personality. Among them, and first most important of them, is fear of the abandonment. The fearing of abandonment is one of the worst traits in this group of the people. We know that fear is a normal emotion that can help us and protect us from the real threat and danger. That is the definition of the fear. That is real, the danger and threat of the harm is real, and there is probability to be hurtful. It can be physical, emotional, and or psychological. But the problem with this fear, this type of the fear of the abandonment, is that is out of proportion with the reality. Everybody knows that there is a chance that any relationship ended, some beloved one passed away, or lose friends for any reason, work, job, situation. Everybody knows that. For example, depending on each society, 5 to 50% of the marriage end divorce after 5 years. Everybody knows that. But in the normal people, they don't afraid of involving to relationship, and it doesn't affect their mind and doesn't eat their brain and mind and thoughts, the fear of that ending the relationship and finishing. But in this situation, person put a scale. If the person normal, if we give a scale from 1 to 10, in the normal people is 1. In these people, the scale of ending relationship and being alone, it become 5, 6, even 10. First of all. Second, their mind unconsciously looking for any evidences and any symptom that show there is probability that person going to live that and this person being left alone and their relationship ended. And for that reason, many of these people, they cannot make a strong and build a correct and healthy relationship, because always they looking for small things to find that unconsciously prove that they are right. Everybody, all guys or all girls are worthless. They will leave you alone finally, and always their thoughts make some behavior and thought that finally damage their relationship, and it give a lot of symptom. Let's see what those symptoms are in fear of the abandonment. Before I go to the symptom of fear of abandonment, I like to mention here the cause of this trait. First of all, this fear of abandonment is not always belong to the borderline personality disorder. Even though the most common cause of and reason for fear of abandonment is borderline personality disorder, but there are other situations that can cause fear of the abandonment, and many times they have very close and overlap each other, that with a professional help they can differentiate them. Another one is childhood trauma. At top of them is sexual or physical or emotional abuse, death of one of the beloved one, any friends, family, parents, that they have very strong attachment to that kid, divorce or parental infidelity and neglect. Those can cause this type of the trait. Another is insecure attachment, separation anxiety disorder, dependent personality disorder, and finally avoidant personality disorder. They are all the cause they can create fear of abandonment, that I am going to talk about each of them in separate clip. Fear of abandonment represents with following symptom. Usually it can be a combination of them or a little spectral different. Each person is different, but usually we can see the combination of them. First, they get attached very easy. After 1 week they think they fall in love, that's it. Or even funny, you can see in the many reality show very easy this type of the trait among those actors and people. Or the person, even they know that they had one night stand, still the next day they expect why the person didn't contact or follow them, even they know it was just one night stand. They need constantly get reassurance that they love that person and they don't leave them for with anything, with the text, phone, constantly they check on them. If they are there, they don't let them be free. It looks like the person is in the jail. Always they looking for reassurance and why don't you tell me. You heard a lot about those songs that the concept meaning, even I know you're lying, but tell me you love me. Even that is not bad if we sometime give them and show them and tell them and express our feeling about the partner, how much you like them, you love them. That is good idea, and we recommend in relationship make it stronger. We do that, but we have to remember, first of all, it should be real from bottom of your heart and real, not just playing, just make that person leave you alone and make a situation calm. It doesn't help in this group of people. Even you do this reassurance behavior and thought and talk, but still they are not satisfied. Still there is in the backbone, deep in their brain, they think first of all you're lying, you are not real. Second, still they are suspicious to that behavior. The bone of such feeling is low self-esteem, and for that reason they usually clinging to the and stalking to a non-healthy relationship, because if they think if ending they become alone and nothing, they become incapable and alone. The feeling of alone being and lonely, and alone is a little difference. They feel lonely, not alone, because some people still they are with other people, but still they feel lonely, but other people opposite way. So those stuck in those unhealthy and toxic relationship, the scare of the being lonely. Another one is codependency. They think they cannot handle their life alone and they are worthless if the person leave. The women especially, they learn that one of the most parameter or uh, the most what do you call it, most tools for keeping guys attract to them and hanging them and being with them is sex. For that reason, many women they involve with the unwanted sex. They involve with some person even that they don't feel good or they don't feel at all or even they don't have attraction. Still, they involved and have sex with that person. And the last one, all those behavior and thought, it sabotage their relationship. How they push the people away because they don't want to escape, they don't want to one day and the probability they will be left. So those people they don't get involved very easy with other people, or even they are involved but their behavior and their action is the way that they push the other person away. And because they scared of that feeling that person leave them alone and they think that person are gonna to be betrayed them. Not all of the people, but some of them, the high percentage of the people, they scared of being betrayed. So for that reason, they in advance they betrayed their partner because they are sure that their partner one day they betrayed them. So the infidelity in this group of the people is very is not uncommon, is common. And finally, they have a lot of shallow relationship. They jump from one relationship to the another relationship. Borderline people, they have very chaotic and turmoil relationship. Even though many of those people, at least at the beginning, they are very compassionate, kind, and caring, and devoting, and romantic. But little by little, the other aspect of their personality will show up that related to those other traits, including fear of the abandonment, low self-esteem, moody emotion, those impulsive behavior. All of them affect their relationship. And in classic form, we will see the love and hate relationship very easy. Someday, one day, their partner is the best and is the king or queen. Other days, they hate them and they want to die. That for them, usually there is some reason, not, but for the other person, this is out of proportion and there is not any real reason for those behavior and emotional change. That is the reason these people involved with very strong but short relationship. They have multiple relationship, and because of fear of the abandonment, they get hand in advance and they start usually break up the relationship, and most of the time is by betraying. So in this group of the people, being unfaithful is more common compared to the normal people. In a work environment, we can see this type of behavior during in our environment as changing the behavior, reaction, and uh, thought of that person compared to other. One day they are very friendly, helpful, smiling, and close, and the other day, without any reason, you can find out or you notice their behavior completely change 180 degree. For them, there is some reason, but for you, maybe not. But they usually, maybe you didn't see them, they think you didn't attention to them, or you behave some way that looks like rejection. All those create their negative thought about fear of the abandonment or rejection. Another trait and symptom of a borderline person is impulsivity. In this group of people, that in some of them is more significant and very obvious, in some other is less, is that they prefer immediate gratification compared to the long-term reward. They prefer right away at this moment. And for that reason, and for avoiding emptiness and feeling fulfillment, they act and behave in the unhealthy way, including multiple casual and unsafe sex. That is really easy for them. The first opportunity, they do that without thinking. Substance abuse, driving under influence. They usually behavior thrill seeking. They looking for some excitement, full excitement. They usually overspending without thinking if they need it or they can afford it. Their mind can change right away from nowhere. In many aspects, this feature is very close to those histrionic people, but the difference between them is that in histrionic personality, usually seeking and taking attention is end of the story. They don't go beyond that usually. But in this group of the people, they want fulminant and end of the gratification. Another feature of borderline personality disorder is self-destructive behavior. The fundamental and reason for this type of the behavior goes to the childhood experience and trauma. They first they feel worthless, and second they become conditional that any bad person that they think they are bad and any bad behavior should be punished, and for that reason they represent this type of behavior and sabotage themselves. The presentation of this behavior and trait can have very wide, from the procrastinating, not take care of their health, hygiene, and to goes drinking, substance abuse, in having unusual sexual behavior like the sadism, masochism, or having sex even they have good relationship, up to physically damage and hurt themselves, and finally suicidal thought and attempt. Especially those episodes happen when the person have very stressful condition and situation, especially in social and personal relationship. Whenever those trigger come up, then this type of behavior become more prominent. In some people, this trait is very significant and obvious and severe. For that reason, many specialists they categorize this group of the people to the self-destructive borderline personality disorder. So it's subtype of the BPD. Most of the borderline people, they have very short temper, and for any small stressful or issue, they suddenly explode and start behaving aggressive verbally or physically, and usually it goes to the other person or to the animal, road raging and cursing. Those all the pattern of the rage and anger. Those reaction is completely out of the proportion cause of it. So that is the reason most of the partner or friends, they become shocked. What is this reaction? Usually this episode of anger lasts 30 minutes, and after that maybe the person regret and feel embarrassed. This type of behavior usually goes back from their childhood, that they become conditional, and they learn that one of the easiest react to the any stressful is acting out. That is, they learned from their childhood, and self-control that in this people is out of the picture. Everybody feel changing the mood during the days. They feel sometime up, sometime down, especially women with those hormonal change. It's very common and normal. We feel sometime sad or happy. But in this people, borderline people, this changing and swinging of the mood is very intense and frequent. From 1 hour goes to another hour. Sometimes each situation and mood, it lasts for a few hours and then suddenly goes to the normal or opposite way, become from sad goes to the happy, and vice versa. And usually there are any stressful or any evidences for the borderline person mind that take as a threaten or goes to those evidences that they feel is sign of the abandonment or rejection or putting down. Those feeling come up. But we have to remember there are not only borderline people, they have mood swimming. In other situation we can expect to see this type of the mood swimming. That at top of them is PMS, pregnancy, lack of the sleeping, low blood sugar, those people with ADHD and substance abuse, all those can cause mood swimming. Another symptom that is alarming and is associated usually with the exposing to self-destructive behavior is a feeling emptiness. In this situation, the person really feeling completely empty from inside. They don't see any reason for doing their job or career. They lose their sense of the purpose, and they don't have any motivation and reason for making a meaningful relationship and connection with other people. Usually at that stage, people, they feel hopeless, lonely, and isolated. And we have to take it this one serious, because it's kind of the proceeding of the self-destructive behavior. A normal person has a consistent personality and identity. They know who they were yesterday, and they know how or who will be today and tomorrow. So there is a constancy, even we have a little change during life with based on the experience and knowledge, but it's still exactly we know who we are, how we can handle our life, and what is our roles and controlling our life and following, pursuing the life and career and relationship. We have a constant roles and identity during our life. But in the borderline people, this identity has been disturbed, and you can notice in during their history of their life, we can see and notice many other symptoms that represent they have lack of the identity or shifting self-image by the contradictory beliefs and thoughts and behavior. Their value during life has been changed a lot without any meaningful reason. They have lack of the commitments and in any aspect of their life, and if they don't have they don't see any role and control in their personal life or social life. So whatever the wind come, they go that way. Dissociation with reality is the worst symptom and last end spectrum of borderline personality disorder, and that is the reason. For this reason, we called it borderline. But because at this level, patient goes to the category of psychosis that can represent as a hallucination, delusion, depersonalization, derealization, identity confusion, and usually is very close to the same experience that the people they have using psychotic drug and abusing like the weed and mushroom, all those stuff. The symptom and sign is very close to the same situation. But we have to remember that that is a normal, a person sometimes feeling daydreaming or getting lost in thoughts and sometimes zoning out. In those situations, the person know exactly what happened and come back to the normal, and they know what is going on. But the people with this symptom, they lose completely their connection with the reality, and they don't aware of it. And this stage is that person need to go to the hospital and get emergency treatment. In short, 2 to 5% of the population age adolescence above, they have this type of the personality disorder. That is the most common form of the personality disorder. 75% of the people are female. They had suicide thought and attempting suicide is very common. Over 70 to 80% of the people during their life, we can expect and they have history of the suicide activity, and 10% of them were more successful. There are 9 criteria for the borderline personality disorder, that if the person has 5 of them, most probably has borderline. We have to remember that in each person they have a different combination of those symptoms. It's not that everybody has the same. They are combination of them can be dependent of what is the exactly root of the disorder, what type of the damage, especially in childhood have. So the combination of them will be different. And fortunately, we even though it is very hard to dealing with this group of the patient, especially in relationship and in society, especially those colleagues. But with the being aware of this disorder and getting help in the long term after a few years or sometime more, going to therapy and support with the friends, family, and group support, they can control their life and go back almost to the normal life. But for the beginning, it's not a good choice for getting involved for serious relationship with this type of the people that they have borderline personality disorder. Those 9 symptoms are fear of the abandonment, unstable relationship, impulsive behaviors, self-destructive behavior, explosive anger and rage, mood swinging, feeling emptiness, identity disturbance, and finally dissociation with reality that we call goes to the category of the psychosis, and that is the reason we called it this disorder borderline. Wish for everyone a sunny day and beautiful life.